This meeting is being recorded.
Hey everyone, good afternoon and welcome to day 2 of the Georgia HFMA virtual spring payer forum. My name is Bill Eichest. I am a past president of the Georgia chapter of HFMA, and I want to welcome all of you here. We're going to give it just a few minutes while everybody joins. People were not able to actually sign in until I opened this up. So we'll give it just a few minutes and then we'll get started with our presentation for today. Hi, everyone. If you're just joining, we'll get started here in just a few minutes. All right, I think we can go ahead and get started. Again, my name is Bill Eichest. I want to welcome you to the virtual Spring Payer Forum. Today we have presenters from Palmetto GBA, Sandra Booker, as well as Jamela Hillary Harris. I want to thank them for their continued support of Georgia HFMA and these payer forums. I would ask you, if you have any questions as they're going through the presentation, please use the chat or the Q&A section of at the bottom of your Zoom screen, and you will be able to submit questions, and then I'll ask them the questions, or we'll wait and ask them at the end if it's more appropriate then. But they're going to give you an overview on some things today, and they'll be sure to leave time for some questions and answers at the end. But with that being said, let me introduce Sandra Booker and Jamela Hillary Harris from Palmetto GBA. Thanks so much, ladies.
Thanks. Thank you so much. Good afternoon, everyone, and welcome to the Georgia HFMA Spring Meeting 2023. As you know, today is April 11th. My name is Jamela Hillary Harris, along with my co-host, Sandra Booker, and we're from Palmetto GBA, your Medicare MAC. Disclaimer, the content in this presentation is intended for Jurisdiction J, Part A providers, and is current as of April 30th, 2023. Any changes or new information superseding this information is provided in articles with publication dates after April 30th, 2023 at palmettogba.com. Providers can give immediate feedback on their customer service experience with Palmetto GBA through our customer experience survey. You can provide feedback on your most recent interaction with Palmetto GBA that occurred via telephone, chat, email, mail, or social media such as Facebook, Twitter, or LinkedIn. When you take the survey, please be sure to select the Jurisdiction J button so we know you're talking to us. All Medicare providers and their staff can also give immediate feedback about their customer experience by completing the MAC Customer Experience Surveys, or MCEs. To provide feedback for the Palmetto GBA website and the Palmetto GBA eServices portal, complete the online Experience MCE survey by using the blue feedback button that appears on the right side of each web page and portal screen, or accept the pop-up invitation when it presents itself. You can also provide feedback for your experience with selected areas by selecting the green Your Opinion Matters / Share Your Feedback button on the right side of the select topic website pages. We have different feedback surveys such as appeals, audit and reimbursement, electronic data interchange or EDI, medical review, targeted probe and educate, provider enrollment and provider authorization experience. We have also the provider outreach and education. written general correspondence, and we have a new survey, which is the Provider Contact Center survey. When completing an MCE survey, please be sure to add details about your experience so we know exactly what you like or what we could do better. We value your comments and opinions, and we look forward to a culture of continuous improvement in the way we conduct business and serve our providers. Palmetto GBA intends to demonstrate its commitment to our partnership by sharing with you the process improvements we implement based on your feedback. By working together, we can enhance your experience and elevate the level of service, education, information, and transparency you have come to expect from Palmetto GBA. You are important. Your feedback may become education for everyone. Today, we shall discuss the following agenda topics: importance of the customer survey, hot topics, upcoming Part A events invitation, Medicare Learning Networks, Medicare Quarterly Compliance Newsletter, navigation tutorial for locating the Medicare Learning Network articles, Palmetto GBA website tutorial, self-service tools such as e-service, web tools and education, web chat, targeted probe and educate, as you all know, TPE, additional documentation requests, ADR, and comprehensive error rate testing contractor, CERT. To discuss hot topics, we have two. Based on current COVID-19 trends, the Department of Health and Human Services is planning for the federal public health emergency for COVID-19 declared under Section 319 of the Public Health Service Act to expire at the end of the day on May 11, 2023. We also have one open CPIL, which we'll go into details about it on a few slides later. Outpatient hospital facility MUEs for evaluation and management of HCPCS/CPT codes update. Join our listserv email updates today so that you never miss an education opportunity from Palmetto GBA. To go into detail regarding the CPIL, the issue is Centers for Medicare and Medicaid Services is aware of an issue with the HCPCS CPT codes 99218 through 99220 for observation services were deleted. The status: there will be no replacement files and no April 1st, 2023 MUE files. The Centers for Medicare and Medicaid Services will implement these changes with the July 1st, 2023 files. At this time, there's no provider action on your part. Medicare Learning Network, Medicare Quarterly Compliance Newsletter. The subscription is for healthcare providers at no cost. The newsletter will provide program and policy details, news and announcements, press releases, upcoming educational event registration and reminders, claim, pricer, and code information, and updates on our new and revised MLN Matters articles and publications. A QR code has been provided for you along with a tiny URL so that you can sign up today. We received calls in the Provider Contact Center requesting navigation to the MLN articles. I'll provide a short tutorial over the next few slides. If you type cms.gov in your web browser, it will bring you to the CMS homepage. Navigate to the top 5 resources section and select MLN. As you can see, I have that circled on the screen for you. The MLN homepage is full of free educational materials for healthcare providers on CMS programs, policies, and initiatives. We will navigate to the publications and multimedia section and select the MLN Matters article at this particular time. These articles explain national Medicare policies on coverage, billing, and payment rules for specific provider types. Sometimes CMS explains information in the MLN Connects newsletter message instead of the MLN Matters article. If there's an article or a newsletter message, you'll find it in the provider education column. MLN Matters articles content doesn't reflect waivers and flexibilities issued pursuant to Section 1135 of the Act or short-term regulatory changes made in response to COVID-19. You can filter by subject or article number to search all years. Leave the transmittal year as any. An example of this is CR 12962. This is very important. These surveys are reviewed by CMS. Example 2 is CR 13065. CR 13065 provides an update for the manual 100-04. This update includes the correct billing instruction for CPT code 99292. Example 3, CR 13074, updates 100-04. This update will clarify the payment methods on vaccines for critical access hospitals. Example 4, updates provider enrollment instructions in Chapter 10 of 100-08. And I've provided details of each change request on each slide for you. Example 5, CR 13064. Given the delayed implementation of our substantial portion policy until current year 2024, the current policy remains in place. As such, when an E&M visit requires a medically appropriate history and/or physical exam in accordance with this code descriptor, these service elements can qualify as a substantial portion when performed. In addition, CMS is updating the IOM with policies finalized for office/outpatient E&M visits in the current year 2020 and current year 2021 final rules. Example 6, CR 13087. This update should reduce the number of two-HICN issues because this change will ensure that the FIS system is identifying and using the correct beneficiary on all transactions within the FIS system. As you all see, we have additional tools. We are going to go through a brief website tutorial. Please be advised that we also have a webinar that's available on demand if you need one-on-one training in regards to website navigation. When you actually log on to the Palmetto GBA homepage, you'll see I have it pointed out in regards to how you'll see your corporate visitors. In this case, we're in the state of Georgia, so you would select jurisdiction J. A lot of times, many people don't pay attention to the bottom of the screen, but there's a lot of good, helpful information in section 3, which is additional services. And then if you are a new provider to Medicare, or if you have someone that you know that's trying to become a Medicare provider, but just doesn't quite know how, then they would use bullet point number 4. Once you select jurisdiction J part A, as you all can see, many of you do use our website, but some calls that come in through the provider contact center are about navigation issues. And as a result, the tutorial really helps, and you can use this for training your staff. I have listed every important area, such as number 1, you see our home, that Palmetto GBA logo, it'll take you back to the home page. 2, events and education. This is where you can easily navigate and find our webinars. You can find modules. It's just an easy access area. Number 3 is quick links if you want to receive our email updates, so that way you don't miss any announcement that comes from the Mac. Number 4, just a general search button. The website has been updated that you can do a one-word search, and it's going to pull up every single thing that involves that word or phrase. Number 5, with the top links, these are like, as this time we have COVID-19, e-services portal and outpatient prior authorization. Number 6, it provides shortcuts. In this case, we talked about the CPLs earlier. If you're not familiar where they are, of course, you see the claims payment issues log, you see CERT, MBI, and Medicare medical policies. Number 7, updates and tools. You'll find important updates as well as helpful tools to improve your experience. In this case, we still have the COVID-19 information, which will be going away soon. And number 8, this is one of our calendar of events. We do have additional areas where events are posted also. Next slide. The bottom half of your screen is very important. Also, it has more information. It'll talk about the top news. Number 10, any recent news that we have going on in the MAC will be posted there. There's links to our social media for number 11. During the footer area, these important links, as I just stated before, are some that many people don't look at, and this can help you when you are trying to find answers to certain questions. Number 13, our chat, the chat button will pop up, and with it, you can chat online with the customer service representative instead of you having to call on the phone, because we do realize that you all are very busy. And feedback. When you leave feedback, as stated before, is education for tomorrow. So please, please take our surveys. Next slide. Again, this goes into details of the main navigation bar. We've gone through several of them already. Things I want you to look at is at the top, if you see number 8, you have the e-services portal. Number 9, the contact us. If you're not sure about an address or a department, if you click on that contact us link, it will take you to an area of every area of the MAC. So you'll be able to make sure that you are mailing your information to the correct departments. Next slide. Okay, with the improved search feature, as I discussed before, it is very easy to navigate. In this example, I typed in TPE ADR. TPE is always a hot topic at our MAC and for our providers. So I wanted to use this for example. If you are needing training or in regards to TPE, or if you find things a little bit confusing, as you can see, we have 35 results in regards to TPE, and you can use this to also help to train your staff. As you can see, if you look at number 5, as far as the relevance, and under it helps as far as sorting, and you can filter by type or filter by topic. What's so important about this, especially filter by type, it tells you if it's an article or if it's a PDF. And with the PDFs, they are printable. Next slide. One moment. Frequently asked questions. This tool is so helpful because you can choose, as we look at the top, number 1, where it shows tools. That's selecting a particular icon that'll take you directly to a department. And once you do that, it'll take you from the main navigation to frequently asked questions by department type, such as CERT, claims, direct data entry, EDI, FQHCs, general. It sorts it for you. You will, number 3, you'll be taken to an expanded view of the question and the response. So in this case, I selected CERT, and when you go to number 3, it looks like a minus sign. So I stretched that out so you all can see the response that's in there. But if you hit the plus sign, the only thing that'll be there is the question. Next slide. Okay. Palmetto GBA uses feedback from providers to make improvements to the way we do business. Our goal is continually to improve your experience while interacting with our customer service teams, education initiatives, telephone, voice response systems, and our website. After reading an article on our website, we are giving you the opportunity to let us know whether the article was helpful by giving us a thumbs up or thumbs down response. You may answer additional survey questions using the blue feedback button on the right of your browser. Also, in the future, the website is going to be updated so that when you're looking at an article, if you think there is something that we should add or take away, you'll be able to type those responses in there too. Next slide. Now we'll discuss Palmetto GBA's self-service tools. Palmetto GBA places a great deal of importance on provider information and education. And in addition to our website and provider contact center, we have a number of electronic resources accessible online. Our live chat feature available via our website is a convenient and efficient way to address concerns or ask questions of Palmetto GBA. Wait times may vary depending on volume, but the chat feature is an alternative to calling us with many healthcare providers, which many healthcare providers find useful. General information concerning wellness, Medicare and tips for managing patient health and claims can be found on Palmetto GBA's Facebook, Twitter, and LinkedIn pages. Connect with us there to share information and join the conversation. With new content appearing daily, there's something for everyone at Palmetto GBA Online. If you or your staff needs to brush up on topics ranging from clinical laboratory billing to hospice election to registering for e-services, the Palmetto GBA Education YouTube channel is available every day, 24 hours a day, 7 days a week. As a reminder, it is important that you never send PHI or PII over social media. Inquiries concerning particular patients or claims should not be made over Twitter or Facebook. Palmetto GBA's e-services portal. You can participate in e-services if you have a signed electronic data interchange EDI enrollment agreement on file with Palmetto GBA. Only one provider administrator per EDI enrollment agreement may register for e-services. The provider administrator may then grant access to the different features of the application to their associates who are provider users. The provider administrator who has the ability to assign additional provider administrators by selecting the admin permission for the user. If you are a provider user, you must contact the provider administrator for your provider to request access to the system. You must also agree to the terms of use to register. If you have entered registration information in an incorrect format, the e-services application will display an error message in red at the top of the screen. Carefully read that error message and enter the information again. If the information you enter matches the information on file with Palmetto GBA, you will be able to choose a password and security questions and answers. Once this is completed, you will receive an email at the email address you registered. You must access the email and click on the validation link. If you do not click on the validation link and you try to log in, you will see the profile screen where you can update or correct your email address and submit. If your email address is correct, you may click on the link to request a new email. Please make sure your email address is correct on your profile before calling Palmetto GBA for assistance. Services that are offered for e-services or functions of e-services are eligibility, claim status, remittances online, financial information, financial forms, secure forms, e-delivery, e-review, and MBI or Medicare Beneficiary Identifier lookup tools. To optimize usability of e-services, we recommend that users verify their system adheres to the following requirements that are listed on this slide. Next slide. If you have your phone, please scan the QR code and go to page 17 of the e-services manual to see the system requirements for installing e-services. I'll give you all a moment. And if you all would let me know if you have any trouble scanning that QR code, because I want you to be able to find it, because e-service is very useful and it's free to our providers. All right, I don't see any questions in the chat in regards to it. Okay. And for those of you who want to learn how to use the overpayment portal, I provided a QR code along with a tiny URL for our e-services video demo of our overpayment portal. And this will make it easy for you to navigate. The e-service eligibility functions are based on CMS HIPAA Eligibility Transaction System, or HETS. When you choose the eligibility tab, you will see a new set of tabs to display information related to your inquiry. Information is presented on the following tabs: inquiry, eligibility, deductibles / caps, preventive, plan coverage, MSP, hospice / home health, inpatient, and Q&B. The first step is to perform the inquiry. When you click on the eligibility tab, you will be directed to the inquiry sub tab first. You can use the inquiry sub tab to enter beneficiary information and submit a Medicare beneficiary eligibility request. The user should enter a beneficiary's information into the fields to protect the privacy of the beneficiary data. All fields entered, including optional fields, must match the beneficiary's data as it is maintained in CMS's HIPAA eligibility transaction system. Otherwise, eligibility data will not be returned. You may enter data into optional fields, but these fields are not required to receive a valid Medicare beneficiary eligibility benefit response. If data entered into an optional field does not match the beneficiary's data maintained in CMS HET system, eligibility data will not be returned on the eligibility response tabs. The optional fields are as follows: subscriber name suffix, subscriber gender, date from, date to. The subscriber is the patient. The patient is also referred to as the beneficiary by Medicare. Two, to successfully submit an eligibility inquiry, you're required to enter either the subscriber's first name or subscriber's birth date, in addition to the subscriber's last name and Medicare ID. Three, the Medicare ID is the Medicare beneficiary's identifier assigned by Medicare. Note, once you have successfully retrieved the beneficiary's information, all of the other subtabs will display information related to that beneficiary. To retrieve all information available, you must enter a valid date range. The HETS 274/271 system we are required to access for eligibility allows date requests up to 4 years prior and 4 months to the future of the current date. Date ranges may not exceed 24 months at a time. Next slide. Other fields are optional. Searches for long periods of time may take longer to return results. In addition, offline claims will not be displayed. Many claims are offline after 3 years, sometimes earlier. Claim status. If your search is for a specific claim number, the details on the claim will appear. If you search using other criteria, a list of claims matching your search criteria will display. You may click a link to view the details of any claims to the list. Other fields are optional. And keep in mind, the e-services manual is available for you, and some of these pictures are from the e-services manual to help you all. No claims are displayed for the date period you have chosen. As a reminder, you may want to choose a different date range or double click your records to make sure you have entered the correct Medicare ID. Claims that are paid, in process, returned, or denied are displayed. Information is retrieved from CMS standard systems and is as current as the standard systems itself. Next slide. Submitting an appeal, e-service and appeal submissions. Providers are encouraged to submit their appeals via Palmetto GBA's e-services portal. By using e-services, providers can submit the appeal request and the complete medical record online. Once submitted, you'll receive a confirmation from Palmetto GBA indicating that the appeal has been received. For more information, please review the appeals section in the e-services manual. You may also complete the forms electronically on our website. Please include your first and last name. You can then print the form, attach the complete medical record, and mail to the address indicated on the form. The appeals form can be found on our website. Please keep in mind that the second level of appeal reconsideration timeframe, 180 days from receipt of redetermination, this can also now be filed via e-services portal, whereas it was not able to be done so before. Next slide. Appeal letters. Appeal letters, also known as Medicare Redetermination Notices, or MRNs, are sent with the results for partially paid services and denied services. If a provider does not have e-services, an appeal letter can be obtained from the interactive voicemail or IVR. If a provider has received a fully favorable appeal, a notification letter would not be mailed. Partially favorable and unfavorable appeals will have a letter of notification issued to the provider. Part A/HHH appeal letter copies can be obtained from the interactive voicemail response IVR system unless it is a master case. Those letters will not be on the IVR. Next slide. Palmetto GBA uses comparative billing reports, CBRs, as an educational tool for providers to use in order to provide insight into your billing patterns and utilization of services in comparison to your peers. eCBR will provide you with the ability to view and download your individual CBR online. The eCBR display will include links to additional education materials and the associated Medicare guidelines. Providers can then use this information to conduct a self-audit to ensure they follow the Medicare regulations and prevent improper claim submission in order to avoid possible pre or post-pay medical review. JJ at one point only had the physical therapy and occupational therapy services using the KX HCPC modifier overview of key components, but we have now also included one for IRF. So please check out our website.
Sounds like we might have lost her there for a minute.
Please check out our website.
There you are. Sorry, I thought we lost you for a minute.
I'm here. But please check out our website for a second eCBR that's available now for IRF for JJ providers. Next slide. Jurisdiction J, Medicare Part A. This is just a screenshot of the various tools that you all have that's available for you. A new tool that didn't quite make this screenshot is our device to procedure code search tool, which is new. So please go on our website and check that out. Okay. We also have videos that are available for you all also. We have the outpatient department prior authorization calculator video. We have the outpatient department prior authorization status tool video. We have a responding to ADR video. We have the e-services video demo of our overpayment portal. And these are just a few examples of the many things that we have available to our provider community. Provider Outreach and Education Department, or PO, educates providers and their staff regarding the fundamentals of the Medicare program, national and local policies, procedures, new Medicare initiatives, significant changes to the Medicare program, and issues identified through data analysis. Palmetto GBA offers education to providers through online teleconferences or live and in-person events. Web chat feature. When requesting a chat on the Palmetto GBA website, a new chat window will appear over the open web page without taking you away from our website. This streamlines the process without the inconvenience of having the web page your own to close. Another new feature is the ability to save a transcript of your chat with Palmetto GBA by clicking a button at the top of the chat window. This task can be performed at any time during or after the chat. Additionally, the available chat topics in the pull-down menu have been expanded to include subtopics to better define for us the reason users are wanting to chat. These updates have been made to give providers a streamlined and improved experience when communicating with Palmetto GBA. Using the chat function on our website provides users with the same set of services as calling the PCC or provide a contact center, but within the convenience of the Palmetto GBA website. Thank you for your time. Now turn the presentation over to Sandra.
Thanks, Jamila. And now we'll start with clinical education. The agenda for clinical education includes targeted probe and educate, or TPE, medical review hot topics for TPE, denials, and comprehensive rate, error rate testing known as CERT. Palmetto GBA may select providers for the TPE process based on and focused on providers and suppliers who have among the highest claim error rate or billing practices that are significantly vary out from their peers. TPE consists of up to 3 rounds of review with a 20 to 40 claim sample for each round. In addition to the provider notification letter, an additional documentation request or an ADR will be generated for each claim that's been selected. And Palmetto GBA evaluates the TPE probe claim denial or charge denial rate against an established threshold at the conclusion of each round. Providers with error rates that exceed the established threshold of 20% may be progressed to the next round. And this information is then communicated to the provider via the probe results information that all providers are issued at the conclusion of the 20 to 40 claim review for each probe. Prior to the start of the next probe, all completed appeals or reopenings are considered prior to transitioning a provider to the next round. If a new claim and charge denial rate are 20% or less, a new TPE results letter will be issued and the provider will be removed from progressing to the next probe. So please provide the documentation that's been requested in your ADR letter within 45 days of the date of the ADR letter to avoid any errors for not responding within a timely manner. And at the end of each probe round, the clinician or a clinician within the medical review department will provide one-on-one education to explain what errors were found and what you can do to prevent those errors in the future. And there's no specific time and there's no specific requirements as to who may participate in the one-on-one education. And anyone that would like to participate, they may, and they also will benefit from the education that's being provided. These are some of the hot topics for TPE that medical review is reviewing. And those topics include therapeutic exercises, hyperbaric oxygen therapy or HBO, neuromuscular reeducation, manual therapy, end-stage renal disease, psychosis, skilled nursing facilities, inpatient rehab services, for neurological and stroke, and drugs and biologicals. And I gotten this question from providers before: can I be on TPE for more than one topic? And the answer is yes, you can. If you fall in that category, if they sample those claims and your threshold is greater than the 20%, yes, you can be on TPE for more than one topic. Now, when selecting topics for TPE review, Palmetto GBA uses evaluations from independent resources such as reports from CMS, the Office of Inspector General or OIG, and other contractors like the Comprehensive Error Rate Testing or CERT and the RAC. Now, once the risks have been identified, review of the claims may be initiated by validating the issues and establishing benchmarks. And the effective reports for the reviewed claims are then analyzed. And then the one-on-one provider specific education is provided by a clinician on the medical review team. If you would like to review statistics and error reporting, you can navigate the Palmetto GBA website by selecting your jurisdiction. In this case would be jurisdiction J, Part A, and then you would select the medical review topics list, and then different articles will populate. For provider notification and additional documentation requests or ADRs, please ensure the process for routing this information to the person or persons who should receive the notification is timely and effective. The ADR will be outlined with the information specific to the service and the claim or claims that were selected for review. If selected for TPE, the provider will receive a notice of review. The targeted probe and educate letter will be addressed to the Medicare provider or compliance officer. At Palmetto GBA, we are very committed to the utmost provider experience. Having that said, it is critical that when you submit the requested documentation, that you would also please provide the point of contact for your facility and practice. This ensures that our medical review team can reach out by phone and speak directly to the one that's responsible for submitting your documentation. And when you receive the ADR, it will include a list of the recommended documentation to submit, and the record should be submitted to Palmetto GBA by one of the submission methods that will be mentioned later within the presentation. And providers are responsible for obtaining supporting documentation from third parties, such as hospitals, nursing homes, suppliers, or doctor's offices. Patient identification, date of service, and the provider of the service clearly identified in the submitted documentation. And we recommend that you include the original ADR with your response. Bill, I'm getting some feedback.
How about now?
Emma,
Yes,
now you understand why I was asking you all those questions, right?
yeah,
This is exactly what I looked at the very helpful. So so going forward, it pretty much is the same frame of reference that I use, but you have a better appreciation. The reason I was asking you those questions, right?
right. And
Okay.
I understand, yeah, because that was the first and the only one I have ever
I
done.
think someone has their microphone
Real good.
not
Hold on,
muted.
Juanita, because I was in that conference, in that Zoom thing.
I think it's Emma. I think Emma has her microphone on. All right, I just muted her.
Okay. Medicare requires that medical record entries for services provided or ordered be authenticated by the author. The method used shall be handwritten or an electronic signature. And if you question the legibility of the provider's signature or your signature, you may want to submit an attestation or have the physician submit an attestation statement along with the ADR. And if the signature requirements are not met, the reviewer will conduct the review without considering the documentation with the missing or illegible signature. And this could lead the reviewer to determine that the medical necessity for the service or services billed has not been substantiated, and electronic submissions are the preferred method. Stamped signatures are not acceptable. And if you're unsure of what type of signatures are acceptable by Medicare, you can go to the Palmetto GBA website and search signature requirements. And we do have an article on signature requirements if you need to refresh your memory or provide education to your staff. So for one of the top denials for TPE, it is an auto denial or no response to the ADR, meaning that the provider failed to respond to the documentation request. And as a reminder, you have 45 days from the date of the ADR letter to submit your documentation. And Part A in home health and hospice providers can view their page 4 note in DDE for a comprehensive explanation of their denial. And we encourage all of our providers to gain access to DDE, as they will be able to see concurrently the status of their claims. Some other denials that are seen are the need for service or item not medically and reasonably necessary. The documentation was submitted that does not support medical necessity. There was no certification, and the recommended protocol was not ordered and or followed. And you can also review some denials on our website. If you go to the medical review tab or topics and then select denials. Now we're gonna go over some CERT information, or the Comprehensive Error Rate Testing Contractor. The CERT program was developed to measure the accuracy of Medicare payments on a national level for each MAC region. It was also developed to assist CMS in understanding the educational needs of the provider community and their contractors, as well as to help prevent improper payments. And please note that the improper payment rate is not a fraud rate, but it's a measurement of payments that did not meet Medicare requirements. It is important to keep your address information up to date and to respond to all medical records requests from the CERT contractor. All services billed to Medicare should have supporting documentation, and please verify with your billing company before sending a reply to the medical records, a reply that medical records cannot be found, to determine if the services were billed in error. Responding to medical records request is not a HIPAA violation, and patient authorization is not required to respond. So please be advised that the CERT contractor is not required to pay for medical records. And you may visit the CERT C3 Hub website, which is listed here on this slide, for more information on how to submit your medical records to the CERT contractor if you have to send documentation. The CERT review contractor issues an additional documentation request to obtain medical records for each claim line sampled for CERT review. So please include the original barcoded cover sheet when submitting the medical records to the CERT review contractor. And an example of what that barcoded cover sheet looks like is right here on this slide. And if there's documentation that's missing, you may receive a call from someone at Palmetto GBA finding out if that documentation has been sent in to the CERT contractor as well. All first additional documentation or ADR letters for CERT are sent to the address on file with the Provider Enrollment Chain and Ownership Systems, or PACOS, for the provider or supplier that billed and submitted the claim. And all other subsequent ADR letters can be sent to an alternate address. And this can be provided, or you can provide this information to the CERT customer service at by dialing 888-779-7477. The focal point for the CERT program is sampling and reviewing claims processed by Medicare to determine if the claims were paid properly. The CERT contractor randomly selects a national sample of submitted claims and requests medical records. The claims and medical records are reviewed for compliance with Medicare coverage, coding, and billing rules. If a claim is found in error, it is assigned an improper payment. Both overpayments and underpayments are considered to be improper payments. And the CERT statistical contractor calculates the national improper payment rate and the MAC improper payment rate. Claims found in error are assigned one of the 5 CERT error categories of no documentation, insufficient documentation, medical necessity, incorrect coding, and other. And the following slides will provide some examples of each category. If no documentation is received by the 75th day after the initial request, the claim will be counted as a full payment error. However, if documentation is received after the 76th day, CERT may still review the claim as long as the claim has not been appealed, or if the documentation was submitted prior to the cutoff date for receipt of late documentation. So please check the Palmetto GBA website periodically for those important updates. For insufficient documentation errors, that means elements of the medical records that were imperative for Medicare payments were missing from the medical record that was sent in to the CERT contractor. This slide and the next slide includes common errors related to insufficient documentation. And please remember to include all documentation to support the service or services billed when submitting medical records to the CERT contractor. These are some more examples of insufficient documentation. And again, please remember to submit all of the documentation to support the service or services billed. If your claim is found in error, Palmetto GBA will adjust your claim based on CERT's decision and will recoup payment if applicable. Claim payments that are recouped as a result of CERT errors may be appealed to Palmetto GBA within 120 days from the date of the initial overpayment letter. So please submit a redetermination form, which is located on our Palmetto GBA website. You may also submit any additional documentation that was previously submitted to the CERT contractor. Palmetto GBA will request the medical records from the CERT contractor, so there's no need to send medical records that you sent to the CERT contractor already. So please be advised that once your claim has been appealed, CERT will no longer review your claim, and please do not submit a request for an appeal to CERT, as CERT does not perform reviews for appeals. Some ways to submit your documentation. You can submit via eServices or via ESMD. You may also fax your information to the JJA fax number here, or if you choose to send it by mail, this is the address that you would submit it to, or you would send it to. These are some resources that you can use or you may find to be helpful. These are more resources. Did you know that Palmetto GBA can connect with you on Facebook, LinkedIn, Twitter, and YouTube? So subscribe or follow us on social media. We want you to keep current with the latest information for Medicare. General information concerning wellness, Medicare, and tips for managing.
For just a second, for those links you started.
I'm sorry, Bill, what'd you say?
Right after you showed those links, you started talking, and I start from that point where you showed the link, the page with the links.
Here. I just said these were more resources.
Yep. Great. And then you just blocked out for a minute.
Oh, okay. I didn't know that. Okay. So did you know that Palmetto GBA can connect with you on Facebook, LinkedIn, Twitter, and YouTube? So subscribe or follow us on social media. We want to keep you current with the latest information for Medicare. General information concerning wellness, Medicare, and tips for managing patient health and claims can be found on the Palmetto GBA's Facebook, Twitter, and LinkedIn pages. Connect with us there to share information and join the conversation. With the new content appearing every day, there's something for everyone at the Palmetto GBA online. So as a reminder, it is important that you should never send PHI or PII over social media, and inquiries concerning particular patients or claims should not be made over Facebook or Twitter.
Sandra, someone's asking if we should expect a TikTok channel from you and Jamela anytime soon.
I don't know.
All right. You let us know when you're ready to take that live.
Oh, goodness. Okay. So we at Palmetto, we value your opinion. So please take a moment to complete our customer service survey by scanning the QR code or using the link that's been provided on the screen, on the slide here. And again, as always, we are very thankful and always open to participate in the Georgia HFMA forum, whether it's spring, summer, or fall. And now I think, Bill, if there's any questions, if you all have any questions.
Well, I would just ask the attendees to submit any questions that they have. Otherwise, you're getting off pretty easy today. I think you covered a lot of really good information. It is my intention to forward the presentation to the people that registered for the event. And I think the chapter website will hopefully have some of this information as well at some point. We've got a new chapter platform online, and so some of that information is not as readily available, but I'm going to work on seeing how I can get this information to you. But some really good information. Anybody that's interested in the information can certainly email me at beikost@comcast.net, and I'll be glad to send you the presentation. This registration link, or this Zoom link, should work for our presentations the rest of the week. Tomorrow we've got United Healthcare on tap. Thursday we've got Anthem Blue Cross, which is now Elevance Health. And then on Friday we've got Ambetter and also Humana are signed up from 1 to 2 and 2 to 3. So I hope you can join us for those. But if there are no questions, I will just thank the ladies from Palmetto GBA, as always, for your continued support of Georgia HFMA. Great job today, and want to thank everybody for your participation.
Thank you. And Bill, before we go, I just want to let everybody know that we are going back on, going to be in person and live for our spring tour. And it'll be coming soon. The registration will be opening up soon for that.
June 8th, you said, for Atlanta.
Atlanta will be June 8th.
Yeah, I'm sorry, I forgot to mention that.
Yeah, Atlanta will be June 8th. And we will also be in Huntsville June 6th, and Cleveland, Tennessee, June 7th. If you're not able to get to one of those events, you can, we kick off in Columbia for South Carolina, but if you're closer to South Carolina or Columbia, you can participate in that one as well. So if you haven't signed up for our email updates, please do so. So you'll be one of the first to know when registration opens, so you can register.
Sounds good. Good information. We appreciate it. All right, everybody, we're right at 2 o'clock, so thank you. And hope everybody has a great rest of the week. I hope you can join us for tomorrow's session as well as the rest of the week. Take care, everybody.
Thanks, Bill. Thank you.
Bye-bye.
Bye.